Okay, so what's the criteria to determine a first degree heart block? Remember, at heart blocks, we're looking at the relationship between the P wave and the QRS. Now, a normal PRI or PR interval is between 0.12 and 0.20 seconds. A first degree heart block occurs when the PRI is greater than 0.20. Now, the second largest box on an ECG paper, that measures 0.20 seconds. So you find a P wave that starts right on that box, and if the QRS is occurring after the beginning of that second box, you got a first degree heart block. They're usually benign, asymptomatic, no big deal. However, we do want to keep an eye on it because we do have a conduction problem somewhere, maybe around the AV node. So not a true emergency, but we want to keep an eye on it. Remember, first degree heart block, a PRI greater than 0.20 seconds. This has been One Quick Question. I'm Mark. Thanks for watching. See you in the next video.